Diabetes and coronavirus. Subscribe and ring the bell for more videos. What is diabetes? Diabetes mellitus is a metabolic disease characterized by high blood sugar, glucose, levels that result from defects in insulin secretion or the body's ability to use insulin. Normally, blood glucose levels are tightly controlled by insulin, a hormone produced by the pancreas. Insulin lowers the blood glucose level. When the blood glucose elevates, for example, after eating food, insulin is released from the pancreas. This release of insulin promotes the uptake of glucose into body cells. In patients with diabetes, the absence of insufficient production of or lack of response to insulin causes hyperglycemia. Diabetes is a chronic medical condition, meaning that although it can be controlled, it lasts a lifetime. In type 1 diabetes, the pancreas cannot produce insulin. Type 1 diabetes was formerly known as juvenile diabetes or insulin-dependent diabetes. Type 2 diabetes is more a result of insulin resistance, cells not being able to use insulin effectively or at all. It was formerly known as adult-onset diabetes or non-insulin-dependent diabetes. Are people with diabetes more likely to get COVID-19? There is not enough data to show whether people with diabetes are more likely to get COVID-19 than the general population. The problem people with diabetes face is primarily a problem of worse outcomes, not greater chance of contracting the virus. In China, where most cases have occurred so far, people with diabetes had much higher rates of serious complications and death than people without diabetes, and generally we believe that the more health conditions someone has, for example, diabetes and heart disease, the higher their chance of getting serious complications from COVID-19. While the death toll is likely to rise as the virus spreads, we expect the death rate, the number of people who die from the virus as a percentage of the total number of people who contract the virus, to go down as we get better at detecting and treating this specific virus. Do I need to worry about DKA, diabetic ketoacidosis? When sick with a viral infection, people with diabetes do face an increased risk of DKA, diabetic ketoacidosis, commonly experienced by people with type 1 diabetes. DKA can make it challenging to manage your fluid intake and electrolyte levels, which is important in managing sepsis. Sepsis and septic shock are some of the more serious complications that some people with COVID-19 have experienced. If your blood sugar has registered high, greater than 240 mg/dl, more than 2 times in a row, check for ketones to avoid DKA. What are the symptoms and warning signs I should be watching out for, and what do I do if I think I'm developing them? Pay attention for potential COVID-19 symptoms including fever, dry cough and shortness of breath. If you feel like you are developing symptoms, call your doctor. When you call, have your glucose reading available, have your ketone reading available, keep track of your fluid consumption. You can use a 1-liter water bottle, and report be clear on your symptoms. For example, are you nauseated? Just a stuffy nose? Ask your questions on how to manage your diabetes. What are the emergency warning signs, and what should I do if I'm experiencing them? If you develop emergency warning signs for COVID-19, get medical attention immediately. In adults, emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. Are the risks different for people with type 1 and type 2 diabetes? In general, we don't know of any reason to think COVID-19 will pose a difference in risk between type 1 and type 2 diabetes. More important is that people with either type of diabetes vary in their age, complications and how well they have been managing their diabetes. People who already have diabetes-related health problems are likely to have worse outcomes if they contract COVID-19 than people with diabetes who are otherwise healthy, whichever type of diabetes they have. What should I do to prevent the spread of COVID-19 in my home, and what do I do if someone in my household has the virus? For people with underlying health conditions, including diabetes, healthy family members in the household should conduct themselves as if they were a significant risk to them. For example, they should be sure to wash their hands before feeding or caring for them. If possible, a protected space should be made available for vulnerable household members, and all utensils and surfaces should be cleaned regularly. If a member of your household is sick, be sure to give them their own room, if possible, and keep the door closed. Have only one family member care for them, and consider providing additional protections or more intensive care for household members over 65 years old or with underlying health conditions. Learn more about how to keep your home safe here. Will COVID-19 impact my access to insulin and other diabetes supplies? Leading manufacturers are reporting that COVID-19 is not having an impact on their current manufacturing and distribution capabilities for insulin and other supplies at this time. We are continuing to monitor the situation and will provide updates should anything change. If you are struggling to pay for insulin or know someone who is, can patients self-test using blood glucose meters labeled for home use while they are in the hospital during the COVID-19 pandemic? Yes. The FDA recognizes that home-use blood glucose meters may be an option to provide relief and support to healthcare professionals in hospital settings seeking to reduce interactions between patients and healthcare providers, thereby limiting exposure to COVID-19, and conserving personal protective equipment, PPE, whenever possible. In addition, some home-use blood glucose meters have built-in wireless data transmission capabilities, which can facilitate remote patient monitoring. Therefore, the FDA encourages hospitals to consider policies to allow patients to self-test using home-use blood glucose meters, which may include leveraging patients' own home-use blood glucose meters or dispensing a home-use blood glucose meter upon inpatient admission to the hospital. Utilization of strategies in which hospitalized patients may conduct their own blood glucose testing, while allowing wireless access to results by healthcare professionals, may limit the number of necessary patient contacts, thereby reducing risk of viral transmission and preserving a hospital's limited supply of PPE. What are the factors that healthcare providers caring for a COVID-19 patient can consider before allowing patients to self-test using a home-use blood glucose meter? In considering whether to allow inpatients to self-test using home-use blood glucose meters, healthcare providers caring for COVID-19 patients can take into consideration the availability of other equipment in their hospitals to get timely and accurate blood glucose readings that can be easily transferred or logged into the patient's medical record. Healthcare providers can also take into consideration whether the patient is well enough or sufficiently lucid to properly conduct their own self-testing and whether the patient is comfortable with using an unfamiliar home-use blood glucose meter, if one was dispensed by the hospital. While a patient may be used to getting blood glucose readings using their own meter, the patient may not be as successful using an unfamiliar model. In the case of home-use blood glucose meters, healthcare professionals in hospitals may choose to have patients utilize home-use meters to monitor blood glucose levels of patients when they have already been hospitalized due to COVID-19. In addition, self-testing by patients, even while in the hospital, is already within the authorized FDA labeling for home-use meters. Can COVID-19 patients with diabetes bring their own blood glucose monitors to the hospital if they need to be hospitalized? Yes. Self-management of diabetes by a patient using their own devices, even in a hospital setting, is consistent with device labeling. If a hospital chooses to dispense home-use blood glucose meters to inpatients, can that meter be used for multiple patients? No. All blood glucose meters labeled for single patient use only, whether dispensed by the hospital to a patient or brought into a hospital by a patient, may only be used by the individual patient. Blood glucose meters labeled for single patient use only may not be shared among multiple patients. This limitation is necessary to prevent transmission of infection between individuals, as these types of glucose meters are not adequately robust to withstand the cleaning and disinfection that would be necessary to enable multiple patient use. Any home-use blood glucose meter dispensed to an admitted patient should either be taken home by that patient or disposed of upon the patient's discharge from the hospital. And now, what is the treatment for diabetes? The major goal in treating type 1 and type 2 diabetes is to control blood sugar, glucose, levels within the normal range, with minimal excursions to low or high levels. Type 1 diabetes is treated with insulin, exercise, and a type 1 diabetes diet. Type 2 diabetes is treated, first with weight reduction, a type 2 diabetes diet, and exercise. Diabetes medications, oral or injected, are prescribed when these measures fail to control the elevated blood sugars of type 2 diabetes. If other medications become ineffective, treatment with insulin may be initiated.
Don't forget to like, share, and subscribe. Thanks for watching.